Most people picture a heart attack as a sudden, dramatic event where someone grabs their chest and gasps for air before calling 911. The reality of clogged arteries is much quieter and more dangerous than that, because the damage happens over decades. Atherosclerosis is the process of plaque building up inside your artery walls, and it usually starts its work without a sound during your 40s and 50s. Your body is incredibly good at adapting to these narrow pathways, so you won't feel a thing until the day your system finally hits a breaking point. You might be surprised to learn that many of these symptoms have nothing to do with your chest at all. One of these red flags shows up on your face, and another only happens while you are fast asleep. Pay close attention to sign number 7, because it catches almost everyone off guard. The first sign is leg pain or cramping that flares up when you walk, but seems to vanish the moment you take a seat. Doctors call this claudication, and it happens because your narrowed arteries simply cannot pump enough blood to your leg muscles when they are working hard. Since resting drops the demand for oxygen, the pain fades away, which leads most people to blame their bad knees or just getting older. If your legs cramp up like clockwork during a stroll and feel perfectly fine once you sit down, you aren't dealing with joint wear, but rather a circulation system that is failing under pressure. Sign number 2 is having cold feet or hands, even when the room feels warm to everyone else. Your hands and feet are the farthest points from your heart, so they're the first places to lose out when blood flow gets restricted. It's very easy to dismiss this as a comfort issue, but treat it as a warning from your vascular system instead. Sign number 3 involves cuts or small wounds on your lower legs and feet that take forever to heal. When oxygen-rich blood can't reach your skin tissue efficiently, the healing process slows to a crawl. A small scratch that takes 3 or 4 weeks to close isn't a skin problem, it's a sign your internal supply lines are compromised. These 3 signs all show up in your limbs, but the next group moves into territory most people never connect to their heart. Sign number 4 is erectile dysfunction in men under the age of 60. This is actually one of the earliest and most reliable vascular warning signs your body can give you, yet most men never hear about the connection from their doctor. The arteries that supply blood flow to that specific area are some of the smallest in your entire body, and because they are so narrow, they tend to clog up first. When a man in his late 40s or 50s experiences ED without any other obvious cause, it is frequently a cardiovascular signal that shows up years before the heart itself starts to fail. Sign number 5 shows up right on your face. Look at your earlobe in a mirror and check for a diagonal crease cutting across it at roughly a 45-degree angle, running from the opening of the ear canal down toward the lower edge of the lobe. That line is called Frank's sign, named after the physician who first documented it in 1973, and it has been replicated in multiple peer-reviewed studies as a marker for coronary artery disease. Most doctors won't mention this during a routine physical, so bring it up at your next appointment and ask specifically about your cardiovascular risk. Sign number 6 happens while you sleep. Loud snoring or diagnosed sleep apnea is more than just a nuisance for your partner, as it creates repeated drops in your blood oxygen levels throughout the night. This puts sustained stress on your cardiovascular system, and that constant pressure actually accelerates the buildup of plaque in your vessels. People with untreated sleep apnea have measurably higher rates of atherosclerosis progression because their arteries never get the recovery window they need. These aren't just random or unrelated symptoms. They tend to cluster together in people who are 5 to 10 years away from a major cardiac event. Sign number 7 is next, and it is the one hiding in the most ordinary part of your day. Sign number 7 is jaw pain or neck tightness that comes and goes, particularly when you are being physically active. Most people assume this is just tension from posture or maybe a dental issue, but referred pain from reduced cardiac blood flow frequently radiates to the jaw and neck instead of the chest. If that tightness shows up when you are exerting yourself and then fades away once you rest, you should treat it exactly like a leg cramp. It is a circulation problem until a doctor proves otherwise. Sign number 8 is feeling a level of fatigue that doesn't match your activity. This isn't the normal tiredness you feel after a long workout, but rather a heavy and crushing exhaustion that hits after doing something simple like climbing one flight of stairs or carrying groceries from the car. When your heart muscle isn't getting an adequate blood supply, even small demands will leave you feeling completely wiped out. Sign number 9 involves brief episodes of blurry vision or sudden changes in how you see. The retinal arteries in your eyes mirror your coronary artery health very closely, which means reduced blood flow or small clots reaching those vessels can cause temporary visual disturbances. Research consistently shows that these retinal vascular changes are a strong predictor of cardiovascular risk. Sign number 10 is a high-pitched ringing in the ears, also known as tinnitus. Recent research has connected this ringing to vascular inflammation and reduced circulation reaching the inner ear. When blood flow to those tiny vessels drops, your auditory system registers that lack of oxygen as sound. That makes 10 signs. These are 10 ways your body has been trying to get your attention, and now you finally know exactly what to listen for. Knowing the signs is a great first step, but your arteries don't care about what you know. They only respond to what you actually do. Let's get specific about how you can take action today. You should start by adding raw garlic to your daily routine because it contains a powerful compound called allicin. Research shows that allicin reduces arterial stiffness and helps prevent plaque from sticking to your vessel walls. And the best part is that you don't even need an expensive supplement. Just 1 or 2 raw cloves a day will do the trick. But you have to crush them and let them sit for 10 minutes before eating to activate that allicin. You can mix the garlic into olive oil, stir it into your dinner, or just swallow the pieces with water. Cayenne pepper is worth adding to your kitchen cabinet next. Capsaicin, the compound that makes these peppers hot, encourages your blood vessels to dilate and reduces the friction that lets plaque accumulate. A 1/4 teaspoon stirred into warm water or mixed into your meals is enough to get those circulatory benefits without setting your mouth on fire. Castor oil packs are something most people in this space overlook, but the evidence behind them is worth paying attention to. You apply a piece of flannel soaked in cold-pressed castor oil directly over your abdomen or chest, cover it with plastic wrap, and place a warm heat pack on top for 45 to 60 minutes. The ricinoleic acid in castor oil penetrates tissue and has been shown to reduce localized inflammation and support lymphatic circulation, which takes pressure off your arterial system. Do this 3 to 4 times a week and make sure you're using cold-pressed, hexane-free castor oil because the processing method matters. Omega-3 fatty acids are the third piece of this puzzle. Fatty fish like salmon, mackerel, and sardines, along with hemp hearts, provide the specific fats your arterial walls need to stay flexible and healthy. You should aim for 2 to 3 servings of fatty fish every week, and you can easily throw hemp hearts into your yogurt or salads since they are basically tasteless. There are 2 specific tests you should ask your doctor for during your next visit. The first one is an ankle brachial index, or ABI, which compares the blood pressure in your arm to the pressure in your ankle. A big difference between those 2 numbers signals peripheral artery disease long before it turns into a medical crisis. It is a quick and cheap test, yet most people have never even heard of it. The second test is a coronary calcium score, which is a low-radiation CT scan that detects calcified plaque inside your coronary arteries. This test gives you a concrete number that tells you and your doctor exactly where you stand, rather than just guessing based on general risk factors. Everything we've discussed today is for educational purposes and isn't a medical diagnosis. If you recognize several of these signs in your own body, don't panic, but do use this as a reason to have a real conversation with your doctor before something bigger happens. Your arteries have likely been sending you signals for years, and now you finally know what those warnings actually look like. Pick just 2 things from this list, like adding garlic and asking your doctor about those 2 tests, and act on them this week. If you want to go deeper into this topic, my video on the signs your heart isn't working properly covers exactly what happens when these early warnings are ignored. You should watch that one next.